You're watching 2+U Nevada, and this afternoon we are at the renowned senior care Del Monte Clinic. Joining us this afternoon, we have Dr. Francesca Rinaldo, Director of Value-Based Care, and we have Michelle Rector, the Executive Director of Seniors in Service. Ladies, thank you so much for joining us this afternoon.
Thank you for having us.
We're so excited to be here, and Francesca, I have to say, the last time that we met, I was so impressed with this clinic that I was telling my family, and they don't even live here, and they want a clinic like this where they live, because this really and truly is a one-stop shop, if you will, for seniors who are members of Senior Care Plus.
That is absolutely true. We really try to line up not just the clinical care, but all of the other health-related care that seniors might need so that they can come here, see the providers, see our care managers, work with one of our personal assistants, perhaps even pick up a prescription from our pharmacy kiosk and walk out the door with all of their needs met.
What really resonated with my mom is she hates getting blood drawn. She hates that because her veins are, different. As you get older, your veins are different. And you have your lab here.
We do. We just opened it in November. It's open for Senior Care Plus members Monday through Friday from 7 a.m. to noon. We're able to get your blood drawn here on site and send it off to the lab. Easy peasy.
So cool. The last time we were here, you and I had a really authentic conversation of what it's like when your parents are aging and you want to be that support for them. And a lot of caregivers now are of a certain age where they're the sandwich, right? They're taking care of littles, they're taking care of younger family members, and they're wanting to ensure that their parents have the best care as well. Do you see that a lot?
We do, and this is actually a topic that's been near and dear to my heart for a long time. In one of my previous roles, I actually used to run a national network of in-home caregivers that would help families with exactly this issue. We know that family caregivers are absolutely essential. They are the unsung heroes of the American healthcare system. I often say that they're actually the backbone of the American healthcare system because the support that they provide to their family members, whether they're caring for an aging parent or a relative or even a neighbor. Honestly, we see lots of caregiving in different forms, right, out there in the community. But we know that that support that they're providing is really facilitating the care, coordinating the care, making sure that individuals have the support that they need to continue to live independently in their homes. Unfortunately, we also know that a lot of these caregivers are juggling a lot, right? Perhaps they have a full-time job. Perhaps they have their own family. On top of that, they're managing complex healthcare needs of the person they're caring for, perhaps even their own healthcare needs. And so at Senior Care Plus, one of the things we're really thinking a lot about is how do we support not just our members, but also their family caregivers so that we can make sure that they have all of the resources and support that they need to be successful.
And that's why you actually invited Michelle to join us this afternoon, because you really refer out, if you will, families and patients to Seniors in Service.
Absolutely. So we work closely with Michelle's organization as one of our key community partners, and we actually will make referrals for our Senior Care Plus members to some of their programs. They have a wonderful respite program that helps families with caregiving needs in the home, as well as a companionship program that we refer to.
And we've touched on it, Michelle, but what do you see as one of the biggest challenges for a caregiver, like what they face?
Well, caregivers, they don't really get a break. So their job is 24/7. So the biggest thing they need is a chance to take care of themselves as well so they can better care for their loved one.
For viewers who may not be familiar, tell folks at home what Seniors in Service is.
Yeah, well, we're a tiny nonprofit and we're based in Sparks. We have 2 AmeriCorps senior programs and our respite caregiver program. So we give caregivers $1,000 vouchers so they can hire anyone who doesn't live in the home to come and help care for their loved one so they can take a break. So this is hard for a lot of people who do care for a loved one because they're maybe a little nervous about who they're going to leave their person with, and so they can pick anyone they're comfortable with who doesn't live in the home.
I absolutely love that. And then you also have volunteer companionship. What's that?
Yeah, through AmeriCorps Seniors, we have a senior companion program. So these folks are mostly isolated. They may have family in town, they may not, but they mostly live alone. They don't drive anymore. So our companion volunteers will come either just hang out with them, take them grocery shopping, take them to medical appointments. So they really fill a gap with they're not ready to move into any kind of housing. They want to stay independent in their home. Our volunteers help them do that.
And then quickly, why is respite so important for caregivers?
Oh, it's just, you can't care for someone if you yourself are super burnt out. So this program, we try to find the everyday caregiver, the people who may not know that the resources are out here. And we just try to link them with resources and help them out.
Well, thank you so much for what you do. And Francesca, thank you so much for inviting Michelle to join us this afternoon. One of the questions that I had is, let's say that someone my age who is not a member of Senior Care Plus, but has parents who are members of Senior Care Plus, can they come here for any of the education or at least tap into, how can I help my parent?
Absolutely. We have an entire seminar series with resources, education on exactly these types of topics. Anyone who can come and participate, especially if they are the caregiver of a hometown health member, we would love to have them. We also have, if, for example, family caregivers are accompanying their loved ones to appointments, we have a whole team of social workers, community health workers, RN care coordinators who can actually sit down with those family members and help get them the resources that they need so that they have the support to keep going.
And where can people find more information about this?
You can go to seniorcareplus.com and look up our Del Monte Clinic, and you can also look up our population health and care management programs.
Wonderful. Ladies, thank you so much for joining us this afternoon.
Thank you.
Thank you for having us.
You're watching 2+U Nevada.